welcome back. It's now time for the Health Corner, and today we are discussing root canal infection. Now, a root canal infection is an oral condition that happens when bacteria invades the inner chamber of the teeth due to untreated dental decay or trauma. Patients with a root canal infection should seek treatment immediately because the infection can spread quickly once the bacteria attacks the soft pulp material of the interior layer of the tooth. Now, joining us for a discussion around this dental issue is dentist Dr. Kagiso Moloi. Good evening, doctor, and it's always a pleasure to have you here.
Good evening, and good evening to the viewer at home.
Doctor, I've explained today in my introduction what a root canal infection is, but I'm sure the viewer at home wants to really understand it in practical terms. So can you please show us what a root canal infection looks like?
Okay. This is a normal tooth with enamel. The pearly white that we see when we smile, it's called the enamel.
Okay.
And just underneath the enamel is dentine. Underneath the dentine is the pulp chamber. The pulp chamber contains blood vessels. It contains the nerves. So what happens is that when there's a disturbance to that, usually it comes in the form of dental caries. Dental caries, we've got what we call normal commensal bacteria in our mouths. These bacteria are just there naturally.
Okay.
But what we do as human beings, we feed them with sugars. And as we feed them with sugars, they release acids. And the acid start eating on the pearly white. And they go into your dentine. And as it goes into the dentine, that's when you're going to start feeling, when you drink something hot or you drink something cold, you feel the sensitivity. That's when usually people go to a dentist and say, I'm feeling pain. And then it goes to an extent of going very deep into the pulp chamber. So it passes through, if you didn't go to a dentist for a filling, it goes into the pulp chamber, and that's when there's a problem. And mind you, this structure here, even if you can bend, even if you are dead for 100 years, this tooth structure remains intact.
Oh.
That's why usually when there are aeroplane accidents, people bend and so, and to identify the besides DNA, they use
the teeth.
They use the teeth. They go get the X-rays from their doctors to come compare with the teeth that they found on the scene of the accident. Or if somebody died in a bush somewhere and they want to identify who's this person, they can also do the same thing. So it means this structure is very hard. So,
now, doctor, I just want to take you a step back where you explained that the mouth contains normal bacteria.
Yeah.
Why should the mouth have bacteria? What is the role of the bacteria?
Everywhere in our bodies, we've got normal commensal bacteria.
Okay.
They are there to keep the stability of things. But if things go haywire, then it becomes a problem, because you end up, as the mouth is a gateway to your body, you end up with problems with your tonsils. It goes into your lungs, it goes into the rest of the body. So if you don't take care of your mouth properly, by just normal cleaning, brushing in the morning, or after eating sweets and stuff, just make sure you brush and floss at least once a day. So if you don't do that, you end up with this situation here. And this situation here goes to an extent of forming an abscess on the outer, on the inner. That means it goes past this position here in the pulp chamber into the bone. That's when there's a problem.
Is that then called the root canal infection?
That's the root canal infection is only in the tooth itself.
Okay.
If it goes to an extent of causing an abscess, it's something else.
All right.
That's called a periapical abscess.
All right.
Yeah.
Let's talk in detail about the causes of this type of infection, the root canal infection.
The root canal infection is either trauma, when you are in an accident, you hit something and your tooth breaks and you don't attend to it, and then as I said, the bacteria start causing problems and go into the tooth itself, and start you get dental caries or decay. After the decay, it extends into infection of the root canal, and then the signs that you're going to feel is severe pain, and there's going with drinking hot or cold, or just speaking, you get air into you're going to feel pain, and to an extent that you can't even sleep, because the more when you're lying flat, the blood is flowing upwards into your head, and then that's why at night people feel more pain. So the best way is to sit with your pillow at the back, sit up and sleep sitting. It reduces the pain. And another problem is that people, they start putting things in there. They start putting the tablet, and I wonder why they put the tablet in the tooth.
Home remedies.
The problem is when you've got a pain on your leg, where do you take the pain? Where do you take the pill?
In the mouth? You swallow it?
You swallow it. So exactly the same as in the
tooth.
As in the tooth. You swallow the tablet.
So it's
the
wrong.
tablet goes to the brain to block the sense of pain. So you can't put anything on the tooth. Please just avoid doing anything to that tooth until you see your dentist. The dentist will prescribe what's needed. Usually it's antibiotics to make sure that we reduce the bacterial load, and to make sure that we give you something analgesic to make sure that the pain goes away. So in that time, we plan around doing a root canal treatment. Root canal treatment is basically removing all the dead tissue or the infected tissue in the canal system, and you clean it up, and then you let if you've got an infection on the apex of the tooth, you let that infection drain out, and then we put something called gutter packer. Gutter packer is just a rubber material that fills in the space where the pulp chamber was, and then it can go back to normal. Yeah.
So, doctor, what you're saying, there are no home remedies to treat a root canal infection?
No.
Not even pulling out your teeth by yourself?
No. Don't try and pull the tooth out by yourself, because it's quite a painful occurrence, and it's not something that you would want to do. The best thing, just make sure that you go to your nearest clinic or to nearest dentist who will make sure that you are sorted out. And another thing is, with these remedies, they usually put things in there. You don't know what they contain. They might be containing a carcinogenic material, which is cancer-causing substances that can cause bigger damage to your face. So just avoid completely. Yeah.
Let's now look at the worst-case scenario should the root canal infection remain untreated.
A worst-case scenario, should the root canal infection go further than that, it's firstly, you get a gum boil.
Sure.
A gum boil is just it's a way of the body trying to just say this is not for me. It's trying to show out and come out. So it penetrates through the body, through the bone, into the soft tissue.
That looks like pus.
Yes, it's pus. It's basically pus. Infection is basically pus. And then the worst case scenario is when you've got what we call Ludwig's angina. It's cellulitis that affects the rest of your tissues from the head to your neck. And the problem with this Ludwig's angina, you won't be able to breathe because it closes your airway, and then they need to open the airway they open a hole here and put a gadget there so that you're able to breathe. And they need to put drainage pipes to be able to drain all the pus. And this happens in a very high care situation in a hospital. So it's very expensive to undergo this.
Sure.
And it's life-threatening. You can die immediately. So basically, there are proteins that go with infection. The doctor will take the blood to check how much of that protein is there, of the infection. If it's over 6, they start on a radical treatment of maybe flagyl, augmentin, and there's another drug that is used there.
All right.
Basically, it will suppress the infection.
Okay.
But if the infection is not suppressed, you end up like that, and the possibility of death it's very high.
Sure. That sounds very terrible if untreated. Well, doctor, we've unfortunately run out of time, but perhaps I can give you just the opportunity to give your final remarks briefly.
Basically, you go to your dentist every 6 months. That's twice a year, and then you make sure that every day you brush after eating. You eat first the breakfast before you go, and you brush.
Okay.
So half the day your mouth is clean. Lunchtime, after eating, usually you don't have a brush. You just go to the bathroom and just rinse out your mouth. And then the last thing you do before you jump into bed, you floss and brush. That's a basic thing. You won't go to an extent of having Ludwig's angina.
Thank you very much for being here, doctor.
It's always a pleasure.
All right. Well, that was Dr. Kagiso Moloi talking to us about the root canal infection, saying that please do not insert any substances inside the cavity or the hole that you will find in your tooth when it decays, or please brush your teeth after eating, not before eating, but after eating. We'll be back after the short break.